Good afternoon, my fellow Coloradans, and thank you for joining in today for an update on the pandemic and where we are in our state. I hope everyone had a safe and happy Martin Luther King Jr. Day. We weren't able to all celebrate together as we have in years past, but next year I know we'll be together again, linked arm in arm, volunteering, enjoying time with family and friends, of course, honoring Dr. King's enduring legacy. Today we have 1,685 cases. We now have 727 people hospitalized for COVID-19 in our state. We have lost 4,502 people in Colorado due to COVID. And I want to express my condolences to their friends, their families, and their loved ones. We also passed a horrific national milestone. Over 400,000 Americans have died from COVID in the last year, reminding us that this pandemic isn't over yet. And every day, sadly, more Americans are paying the ultimate price. Over 400,000 mothers and fathers, aunts and uncles, brothers and sisters, sons and daughters. And I express my deep condolences to everybody affected by this pandemic. Currently, our estimates are that 1 out of every 105 Coloradans are contagious with the virus. So we need to continue to be careful and be aware. That means if you encounter 100 people a week, it's likely that one of them is contagious. And remember, a lot of people are contagious pre-symptomatic, meaning they're contagious for a day or two before they feel sick enough to stay in, or even asymptomatic, especially in the case of people in their 20s and 30s. Good news, with the increase in testing, we've dipped back below the 5% positivity rate for the first time in months. That means we're getting better surveillance on where cases are. It was not in December, not only did our cases increase, but we had a much higher positivity rate, meaning we knew we were missing many more people that were contagious and were sick that simply weren't getting tested. So we're now back below 5%. That's good news. We need to double down on what we're doing in the final few months of the pandemic as we rapidly seek to get every Coloradan who wants it vaccinated. On that front, I know there's a lot of Coloradans, especially people age 70 and up, asking questions about how and where to get vaccinated. From day one, our focus is distributing every dose of vaccine that we get from the federal government to save lives and end the pandemic. That's why we prioritize for frontline healthcare workers, residents and staff at long-term care facilities, and we are now very active in doing every Coloradan age 70 and up. The goal to protect 70% of Coloradans over age 70 by the end of February. We feel that we are on track to do that. And I know there's a lot of frustration for people over 70 who want the vaccine right away. And of course, I'm right there with you. We are using every vaccine that we get in our state every week. No doses sitting on shelves. We are constrained by the amount of doses that we get from the federal government each week. We will use every dose, and that means that it's going to take us till the end of February at current supply levels to get everyone who wants it over age 70 vaccinated. We're hoping that supplies increase. If they will, it'll happen faster. But we do have the degree of confidence that if you are over 70, you will be able to get the vaccine by the end of February. That means some will get it this week, some will get it next week, some will get it in mid-February. We're doing everything that we can to get every vaccine that we get in Colorado to help out into the arm of somebody over age 70 to begin that protection clock for them. And I love hearing the stories of Coloradans 70 and up who've received their vaccines, who are looking forward to hearing from their friends each week as more and more folks are inoculated. This week is a big week for people over age 70 because, as you know, we moved about 40,000 vaccines up to this week, in addition to the 80,000 or so that had been targeted to get everything that we have in state into people's arms. So that's about 120,000 Coloradans, 110 to 120,000 Coloradans over the age of 70 who should receive the vaccine this week. That's exciting. That's 1 in 5. 1 in 5 Coloradans over age 70 will get vaccinated this week. Now, sadly, that also means that 4 in 5 won't, because the supply isn't here. And you might not be able to set up an appointment until the week after that. But it is a high watermark that 1 in 5 Coloradans over age 70 will be able to receive the vaccine this week. And because the extraordinary times call for extraordinary measures, I sent a letter to all of our partners that administer the vaccine, directing them to use all the Moderna and Pfizer vaccine they have. including the ones that were designated as second doses, to use them as first doses this week. We'll backfill second doses in future weeks from future supply. I mean, everybody will get their second dose on schedule, on time. You need that second dose to have the 95+% level of protection. The first dose does confer some protection. That's why there's such a rush to get that started. Not the day after you get it, but 2 weeks after you get that first dose, you're protected at a lesser level, not the 95%, but a lesser level. So we want to do everything we can to save lives, end the pandemic. That's what the vaccine will do. We hope that the incoming administration can provide more visibility and transparency to us so we know what is coming. Right now, we find out 3 or 4 days ahead how many vaccines we're going to get for the following week. I let the Biden transition team know that we hope that we can get to a point where we have 2 weeks notice or at least 10 days notice so that every dose can be used even quicker, and that appointments won't have to be canceled because there's no vaccine, which would be even more frustrating for seniors in our state that we're expecting to get it. We're in a race against the virus, a race against time. Every dose counts, and there is no time to waste. If you're not signed up yet on a list, you're over 70, covid19.colorado.gov. Click on vaccine providers. It's very simple. It's easy. Most of them have phone numbers if you don't use online forms well. And once you're on a list, again, it could take a week, it could take 3 weeks till you're called up in a randomized way, which is what they're doing. And if you do get that email or call to set it up, jump on it and set it up, right? Act quickly to set up that appointment. If somebody is trying to charge or get your credit card information, it is a scam. Do not reply. These are only legitimate providers. It's hospitals that you know. It's community health clinics. It's free to everybody. The interaction should be limited to setting up a time and your name and perhaps your birth date. Very, very little personal information. There should be no credit card or payment information involved, and that's an important message to get out. We're also partnering with community health organizations across the state to ensure equitable access regardless of where people live. We partnered with Valley-Wide Health in Alamosa to vaccinate more than 200 people aged 70 and up in the San Luis Valley, continuing our work there. We just held a vaccination clinic that we worked with Salud Family Health Center in Aurora for people who didn't have hospitals or insurance and were able to go in, and hundreds of people over age 70 were vaccinated. I also want to take a moment to thank all of our providers we work with, all the partners that are doing the work, getting the vaccination into arms, those that are moving up their second doses to first doses, those that are transferring their doses to other providers who can. Thank you. Our local public health agencies who are nimble every day throughout the pandemic, especially their involvement in the vaccine distribution process. Colorado is among the national leaders in successfully getting the vaccine into arms. We've consistently been in the top 10 states in percentage of supply used and percentage vaccinated. I'm proud to report that over 5.5% of our population has received at least the first vaccine. Doesn't mean they're all fully protected yet. Again, begun the protection clock. Over 5.5% of our population has received the first vaccine. That's exciting news that we're on our way, not there yet, on our way to ending the pandemic. Often the decisions are made quickly, and we need to be aggressive when the opportunity presents itself to vaccinate more people. And you may get a call last minute, come in tonight or tomorrow and get it. I encourage you, if you're over 70, jump on it, right? Be flexible. You might not hear anything for several days, and then hopefully, again, you can schedule out a week. But because right now we get very little notice, it might be come in tomorrow, get vaccinated. Very easy, 15 minutes. I've heard from so many people across Colorado. If you're over 70 and been vaccinated, comment below on your experience. It's been overwhelmingly positive. The biggest frustration is I don't know when I'm going to get it. I don't have an appointment yet. And again, 1 in 5 people over 70 will get it this week. Sadly, that means 4 in 5 will not. And then, of course, we have tens of thousands of people over age 70 who've already received their first vaccine. Switching gears a bit before we open it up to questions, tomorrow is National Inauguration Day, that 4-year ritual of renewal for our democracy, our republic, swearing in a new commander-in-chief. I know there's been questions about security and preparations. First, I want to say that the peaceful transition of power is a core tenet of our republic. And I was proud to be present this last weekend at Buckley Air Force Base for the send-off of more than 200 Colorado National Guard members to prepare to do our part, Colorado's part, in securing tomorrow's inaugural ceremonies in Washington, D.C. They'll be stationed near the United States Capitol. They're already there. Here in Colorado, we're monitoring the security situation. We're getting fully briefed by our federal and local partners in the event that any protest becomes violent. We, of course, cherish our First Amendment rights, but I have full confidence that our state patrol, local law enforcement will ensure the safety and well-being of our fellow Coloradans. In addition, I'm signing an EO today to activate our Colorado National Guard to be ready and on call if needed to respond to defend our state capitol or other potential targets. Our democracy preserves the sacred right to free speech, but it does not enable or facilitate the perpetuation of violence or destruction. This country does not stand for violence and destruction, and Colorado does not stand for violence and destruction. As we close today, I want to remind Coloradans that we need to redouble our efforts to protect ourselves and the people we love from this deadly virus. We're getting there. Over 5% of the state already vaccinated. This week, 120,000 people over 70 will get that first dose. Again, starting the clock doesn't mean they're protected the day after you get the vaccine. 2 weeks after some protection, a month and a half after full protection, 95% plus. So in the meantime, we need to double down on what works. Wear a mask when you're around others, stay at least 6 feet away when you can, and limit social interactions to people in your own household whenever possible. Save lives, end the pandemic, get back to normalcy. Thank you, Colorado, and I'm happy to take questions.
Hi, Governor Polis. Sarah Flower here from KSUT Four Corners Public Radio in Ignacio, Colorado on Southern Ute Indian Tribe land. I have a couple of questions for you both about the equity of the distribution of vaccination and that rollout and what that looks like here to Colorado's two tribal nations, the Ute Mountain Ute and the Southern Ute tribe. Have you had questions or conversations with the new tribal chairman for the Southern Ute tribe, Melvin Baker? And also, in that same realm, here in Durango at Fort Lewis College is home to roughly 200 students from different tribal members, 200 different tribes that are represented at Fort Lewis College. Will that be a priority for higher education once they come back to in-person learning starting in February? Thank you.
Yes, I had a congratulatory call with Chairman Baker upon his election and look forward to our sovereign to sovereign relationship with both tribes that hold land in our state. The Ute Mountain Ute and the Southern Ute have their own allocations and do their own prioritization as the tribal nations that they are. We've heard that they're focusing on tribal elders and others and people that are able to retain their linguistic heritage, and that is they have the autonomy to do that with the allocations that they have received from the federal government. We'll be happy to follow up specifically with anything else, but I have had those conversations. With regard to Native American students that are enrolled in tribes in other states, if they're here, they are subject to the same prioritization as any other Coloradan, but they may be able to, if their own tribe has an allocation and prioritizes it in a way where they have access, they may be able to have access to that back home in Arizona or New Mexico or Nevada or wherever they're from. But in Colorado, they will be treated like any other Coloradan. We make no distinction on national heritage or citizenship or whether somebody's enrolled in a tribal nation.
Hi, Governor. It's Jessica with the Post. Can you tell me more about what you're looking for before you decide to expand the people able to get the vaccine to 65 and older?
Yeah. So right now, we know here in Colorado that 78% of our fatalities from coronavirus are over the age of 70. And just over 40% of our hospitalizations. So we can protect our most vulnerable population, people over 70, reduce hospitalizations by 40%, reduce deaths by as much as 3/4. That's why, just based on the data, that's a priority. The biggest challenge in setting a specific date now for 65 and up is we don't know our supplies and how many vaccines we're even going to get next week. We won't find out till Thursday or Friday what we're going to get next week. So we need to have more visibility in the supply chain, make sure that we have enough to successfully vaccinate not just 1 in 5 people over 70, but as we talked about, 4 in 5, right? Over time, 70% or more. is what we want to achieve. Based on very conservative estimates, that can occur by the end of February. If there is increased supply, which we certainly hope there is, either Moderna or Pfizer, or if there are additional effective vaccines like Johnson & Johnson that come online, then that date would be moved up.
Governor Charles Ashby from the Grand Junction Daily Sentinel. Hope you're doing okay. Our health department wants to open up our convention center starting next Monday, so he can take in more vaccinations or give out more vaccinations, even though they don't currently have them, to get to the number he wants to get. At the same time, I'm getting calls from people all over the Western Slope who are questioning the numbers, the distribution of vaccines that are coming to rural areas as opposed to what's staying there in the Front Range. So I'm wondering if you can give any assurances. I know you don't know the full number of what you're going to get, the state's going to get, but any assurances about how it's being distributed to less populated areas? Are they getting their fair share?
Yeah, we are not getting enough vaccine from the federal government anywhere in the state. We would have the ability to utilize 3 to 5 times as much vaccine each week with our current distribution infrastructure. So whether it's Mesa County Health or whether it's Denver Health, they are likely getting a quarter or less of what they would be able to use because that is the limit of supply. Literally, for our entire state, we received about 80,000 vaccines this week. And they haven't even told us what we're going to get next week. So a state of 5.7 million people, 80,000 vaccines in a week. So I hope that the incoming administration is able to ratchet up that supply significantly so that all of our partners, including Mesa County Health, are able to have the vaccines they need to protect people 70 and up, and then 65 and up, and workers in critical areas like teachers.
Hey, Governor Polis, Seth of the Gazette. With all of the changing kind of vaccine shipment news, we've gotten some concern about whether second doses will be readily available on time. I'm curious if you can speak to that at all. Thank you.
Yes, second doses should absolutely be available on time. The state is moving to real-time inventory management, meaning the week that you need a second dose, we will use the doses that are received that week. We have confidence that the supply chain at current levels is stable. What we're not confident in and don't know is, will it increase? We hope it does, but the second dose does not rely on an increase. That can be supplied from the current flow, and we are optimistic that the number of vaccines delivered to our state will increase over time. That's essential. If we're going to reach 100 million people vaccinated in the first 100 days of the Biden administration, which President-elect Biden has indicated is his goal, then the federal government has to pick up the pace of delivering vaccines.
Hey, Governor, this is Kara Mason from the Sentinel in Aurora. You mentioned a letter that you sent the transition team, Biden transition team. I was wondering if you got a response to that yet. And then also looking back at the last year or so, what is your biggest takeaway of working with the Trump administration during the pandemic, and what do you think or hope will change going forward? So
it was first of all, it was a verbal conversation, not a letter. I had phone calls with the 2 phone calls with the Biden transition folks and 1 Zoom with other Western governors. So three conversations in the last week where they were in very much a listening mode. I talked about the need for greater visibility. It would be great to know a week or 2 in advance rather than 3 or 4 days in advance what we're going to get. More supply, more supply, more supply. We're ready to get it in the arms. They talked about would it help if we had FEMA set up clinics. We said that's all fine, but we could deliver 5 times as much vaccine today in Colorado without any assistance if we just had the darn vaccine. So that's kind of the point we made clear. What was your second question? Aurora?
Yeah. I'm here. Just looking back at the last year of working with the Trump administration, what would be your big takeaway, and what do you, I guess you've already answered, just kind of what you hope to change with the next administration?
Well, the key thing we value is confidence in all of our partners. I hope that they really put the A+ team on this to really help get every possible dose out as quickly as possible. Based on comments that have been made by Pfizer, I still believe that there are doses that are being held back at Pfizer, not by the federal government, that the incoming administration can order to be distributed to the states. We're not counting on that for our plan, but based on what Pfizer has said, reading between the lines, that it certainly seems to be what they are broadcasting. So let's have confidence. Let's accelerate this. Let's treat this with the urgency that it requires. We have lost 400,000 Americans to this virus. This cannot end soon enough. And we need to get this done. 100 million, 100 days, good goal. That'll go a long way towards ending the pandemic.
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión, Colorado. Gobernador, en español, ¿qué puede decirnos sobre los fondos aprobados por FEMA y para qué serán utilizados y si incluye ayudas para las minorías?
Este dinero será utilizado para continuar nuestros esfuerzos de hacer exámenes de COVID, por ejemplo, y todas las personas en nuestro estado tienen acceso a esto gratis, simplemente gratis por todo para recibir un examen.
Hello, Governor. This is Jennifer Oldham with the Washington Post in Denver. I have a two-part question regarding tomorrow and the inauguration. Have any credible threats against facilities in Colorado been received? And you mentioned the National Guard, that you're going to issue an EO activating them. Will they be visibly present at the Capitol tomorrow?
So first, we are not aware of a Colorado-specific threat. There's a general threat that all 50 state capitals have been apprised of. We don't have a specific threat particular to ours within that. Secondly, we will have the National Guard in reserve ready to respond within minutes if there is the need to in the Denver metro area. The visual presence at the Capitol will be Denver Police Department, state troopers, and allied police departments from other major metropolitan areas who are working in conjunction with Denver to help protect the city building and the state capitol. Did you have a follow-up question?
No, that was it, the visible presence. So there will be a visible law enforcement presence at the state capitol tomorrow.
That is correct. Denver Police Department, state troopers.
Okay. Do you know if they are going to block off any streets or any other barriers be put in place?
Denver Police has not announced any plans in that regard, but I would stay tuned and you can ask the city of Denver.
Thank you.
Good afternoon, Governor. This is Stephanie Rodriguez with Telemundo Denver. ¿Me podría dar un resumen de lo que mencionó al inicio de la conferencia y también contarme sobre los esfuerzos para asegurar que los residentes elegibles puedan registrarse fácilmente para recibir la vacuna y si pues esos sitios web serán multilingües para que pues la gente pueda leerlo en su idioma?
Hoy hablé de que estamos comprometidos a vacunar a más que 70% de los coloradenses quienes son mayores de 70 años antes de el fin de febrero. Ya que el 78% de las muertes de COVID son de estas edades. También habla de que esta semana le estamos permitiendo a los hospitales a que usen vacunas que tienen reservadas para la segunda dosis como primeras. Esto es alrededor de la 40,000 dosis y que sean utilizadas para las personas mayores de 70 años. Esta semana en Colorado podemos vacunar a más que 110, 120 personas mayor que 70 años. Pero ser muy claro que esto no cambia nuestro compromiso de que es la segunda dosis a las personas después de recibir la primera vacuna porque es necesario para tener protección. En cuanto a las páginas de vacunas, sé que muchos de los proveedores como UC Health, Vail Health, Denver Health tienen la información en español. Puede usar también nuestro sitio de red covid19.colorado.gov, usar vacunas, proveedores y algunos tienen información en español también. También todos los centros comunidades de salud también tienen información en las dos idiomas o más. Gracias.
Hi, Governor. This is Esteban Hernandez over at Denverite. We've noticed some discrepancies among Denver neighborhoods showing wealthier ones are getting vaccines at higher rates than other more working class neighborhoods when it comes for people 70 and over. These working class neighborhoods include places with large populations of people of color. You spoke about this a little bit earlier, but can you provide some specific examples of how the state is working with cities and hospitals to ensure equitable access for vaccine distribution?
Yeah, equity in vaccine distribution is a top priority for us. What does that mean? In addition to working with the conventional hospital system, the UC Health and the Centuras of the world, we've engaged the community health centers like Denver Health around equity, and we also have looked at stand-up clinics to serve those who are medically underserved. We work with Black Church and predominantly Black Church in Denver last weekend to vaccinate over 150 members. And we look forward to partnering with community-based organizations to make sure that we can have stand-up clinics in areas that are hard to serve. That's why we also work in the San Luis Valley in some of the very lowest income zip codes in our entire state. Also majority minority in those areas, including San Luis and Center. So this is a lens that we've had from the very start. And we know that while, of course, we want to continue to work through the conventional hospital system that will carry the bulk of the vaccinations, it's important to augment that with community health clinics and stand-up clinics in medically underserved areas to achieve better equity.
Hi, Governor Polis. Liz Gilardi here with Denver 7 News. And I just wanted to know, what have we learned from the 70 and up rollout that could be applied to future groups as you open up additional groups?
Well, number one, we need more vaccine. We need more vaccine. We need more vaccine. I mean, it is frustrating how slow we are receiving vaccine for any group. This week, our banner week, it's still only 1 in 5 people over the age of 70 that we have enough vaccine to vaccinate. A lot of the problems and frustrations that we hear would be gone if the state received 3 or 4 times the amount of vaccine, because we'd be able to essentially get to everybody over age 70 who wanted it this week. That's simply not mathematically possible due to the quantity of vaccine. Look, there's different kinds of ways that people over 70 can schedule it. There's pharmacies, there are local hospitals, there are community health clinics. And what a lot of people want to make sure is when they're on a list, will they get called? And the answer is it's randomized and they will. You may be on a list with Kaiser or UC Health. And by the way, you don't have to be a member or have gone to those institutions. If you sign up on their public-facing portal, you're put in the same randomized database as their own customers, given the same treatment. It might mean you are able to set up an appointment in 2 days. It might be you're able to set up an appointment in 2 weeks. So I hope that those over 70 continue to work to make sure that they have the opportunity to get vaccinated. It's easy to get on a list. Just recognizing that might mean you're called in next week. It might mean you're called in 3 weeks. Do you have a follow-up question?
No, I do not. Thank you.
Okay. Thank you. And as the vaccine, I'll just add that the vaccine distribution will only get better over time. But the biggest thing we suffer from at this point is simply lack of vaccines. While we're able to administer slightly more this week in a state of 5.7 million people, we're only receiving 80,000 vaccines for our entire state in 1 week. There's going to be a lot of frustrated Coloradans who aren't among that fortunate or lucky 80,000 who has their name called for an appointment, or the 120,000 this week. That's a one-time bump. Next week, we will not benefit from that one-time bump and moving to real-time inventory management. Stay safe, Colorado. Keep a distance from others. Wear a mask. Avoid social interactions with people outside of your home. The end is in sight. 5.5% of Coloradans, more than 5.5%, have gotten their first dose. This week alone, 1 in 5 Coloradans over the age of 70 will get their first dose, which means they're on the clock for full protection in a month and a half or less. Thank you, Colorado. God bless America.